Hello, Arlington ISD parents and guardians. I'm Myra McLaughlin-Sutton, licensed master social worker with the Family and Community Engagement Department. I'm here with another installment of our Motivational Moments. May is recognized as Mental Health Month, and today I have Angela Smith, Executive Director of National Alliance in Mental Illness of Tarrant County. NAMI is the nation's largest grassroots mental health organization dedicated to building better lives for millions of Americans affected by mental illness. Angela, thank you for joining us today.
Thank you for having me.
In the media, we often hear the words mental health and mental disorder used interchangeably. Can you tell us the difference between the two?
Of course. While mental health is always there and may be positive or negative, mental disorders affect a person's ability to function over a period of time. A mental disorder is not the same as feeling sad or depressed for a small amount of time. It's a diagnosed mental health illness. You may feel situational sadness or difficulties, but that is your mental health at this exact time in your life. It's important to know that it's possible to have good mental health even if you have a mental illness. Just like with other conditions, many people with mental illness will have good days and bad days, and periods of good mental health and bad mental health. Taking care of your mental health is important for everyone.
So thank you for that. I think that that's super important for people to know the difference between the two. So can you give us some examples or common mental health disorders that are diagnosed in children?
Yes. So in children, we often see anxiety disorders, attention deficit hyperactivity disorder, which is ADHD, depression or other mood disorders, and post-traumatic stress disorder, PTSD.
And while we know that that is not a complete list of all the things that children can be diagnosed with, I felt it was important for us to have some of the maybe top ones that children are experiencing. So tell us, what are some signs or symptoms that parents should pay attention to?
Well, commonly we overlook the causes of emotional and psychological trauma, including the loss of a loved one, a recent surgery, changing schools, a divorce, a big move, or a deeply disappointing event or experience. However, the basic symptoms include the drastic changes in behavioral and personality. So decreased interest in activities, spending a lot of time isolated, fights with loved ones, mood swings, feeling sad for more than 2 weeks at a time, very noticeable lack of communication, new fear of things, especially if it's a fear of something that they've already been doing and there's no cause for that fear, and physical symptoms, common headaches, racing heartbeat, stomach aches, and trying to miss school.
Right. I know that's a lot of information for parents to take in at this moment. So how prevalent is it for children, and at what age can they be diagnosed?
Well, we know that 1 out of every 6 children in the U.S. will experience symptoms in a year. Half of all mental illness begins at the age of 14. What many people don't know is that it takes 8 to 10 years for a diagnosis or treatment intervention. So a 14-year-old would be 22 or 24 before they're even diagnosed or start to seek treatment. Children have been diagnosed as early as 6, but often it's between 8 and 10 years of age is the average with proper awareness.
All right, thank you for that explanation. So can you tell us why early intervention is important?
Like many things, your mental health is a key component to a person's ability to function and learn to cope with events. Early brain development has effects on the academic and the social and emotional and behavioral achievements of adulthood.
Okay, that's a lot of information, I think, for parents to know. So basically, the early intervention is probably key to making sure that they're going to be successful in life. So what are your recommendations for parents who might be concerned or notice symptoms that you have talked about?
Well, first, they want to have an open conversation with their children. It's very important. Secondly, if you're worried about your child's mental health, consult your healthcare physician. Let them know what's happening in your child. Keep a journal so you have records when you go to those appointments. Talk to their teachers, talk to their friends and other family members, caregivers. Ask if they've noticed changes. If someone approaches you with a change, make note of that, be aware. And then, of course, describe those behaviors to your healthcare professional.
Right. I think journaling and always keeping notes of what is happening with your child is super, super important. It will help with that early detection. So tell us how we can ease the fear or worry associated with getting mental health help.
Many people struggle with getting help with mental health, not just children. So with children, the biggest thing to do is to have an open conversation. Too frequently, we blame mental health challenges on the person experiencing them by saying, you're not trying hard enough, or what you're doing is wrong, and that puts fault on them. They take the blame of that, and we don't want to do that. So instead, you want to have an open conversation, allow them to feel comfortable expressing those feelings and tell you what's happening in their life. Because when you talk openly to your children, you decrease the stigma, and it shows support for them.
Right. And so again, we know that during the month of May, there's a lot of focus placed on mental health, and we know how important that is. And so I think the most important thing is to make sure that we do early interventions so that we teach our young people how to cope future in their lives. And so, Angela, thank you for joining me today to provide the valuable information about mental health to the AISD community.
Thank you.
It is important to remember that mental health can change over time. Also, it is equally important to have good mental health and physical health, as it can increase the risk of long-lasting health conditions like heart disease, stroke, and cancer. If you or someone that you know wants to learn more or need assistance, we have provided links to several entities who can help. Again, I'm Myra McLaughlin-Sutton, licensed master social worker with the Family and Community Engagement Department. I look forward to seeing you around Arlington ISD.